Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A study published recently in the journal Neurology shows an association between cavities and gum disease and ischemic stroke. Here with me to talk about this are Dr. Moma Begum and Dr. Ron Miller. They're both neurology residents, physicians who are training to become neurologists at Upstate. Welcome to the Informed Patient, both of you.
Thank you.
Thank you for having us today to talk about this.
We'll get into the details of the study, but first, can you tell me if gum disease and cavities are generally seen as risk factors for stroke?
Yes, absolutely. It's been known for quite some time. However, I think the study that you were talking about, the most recent one, I believe that they looked at for 2 decades to come up with the conclusion, and the data has shown that there's a significant ischemic, especially ischemic stroke. I believe it was like close to 88 percentile, as opposed to if you just have the gum disease alone, that's about 47% increase. But if you were to just say that increase, and a normal person with normal oral health hygiene will have about 4% risk of having a stroke in their lifetime. And the number goes up to, I want to say, about 7% or 6% for someone with a gum disease only, and about 10% with gum plus caries. So yes, there's significant risk factor.
Let's go over some of the definitions too. So how do you define gum disease or periodontal disease?
Simply, it's an infection of the tissue around the teeth. If you can imagine, you don't take care of your teeth over time. You're not brushing every day. You're not flossing. So usually your dentist will tell you brush twice a day, floss twice a day. So if you're not doing those, on top of that, let's say if you're a smoker or a drinker or have high blood pressure, over time, your blood vessels around that tissue can, just like a blood vessel elsewhere, can become clots. Imagine that tissue is not getting enough blood flow, can have at risk for infection. And then on top of that, if you're not having a good daily oral hygiene, that can prone you to gum disease.
And similarly with cavities of the teeth itself, right?
Exactly, yeah. Essentially, they're permanent damage. So just the gum disease, something that you have infection around the teeth, but cavities, they're permanent damage to this tooth itself. For example, they can undergo decay and it's not reversible. Gum disease, you can slow down by doing the daily hygiene and brushing your teeth twice a day and then flossing. However, if your dentist tells you, hey, you already have gum disease, you need to have a little bit more care, then definitely you have to follow their recommendations.
And Dr. Miller, we're talking about ischemic strokes. Can you describe how those types of strokes occur?
So ischemic strokes are essentially a process by which the vascular supply, or the blood vessel that gives the brain nutrients and oxygen, is choked off, usually by a blood clot, and they can come in several forms. We kind of break them down in neurology using what we call the TOAST criteria. So we look at how the occlusion or the obstruction of blood flow occurred, kind of break it down into 5 categories generally. There's atherosclerosis, so the hardening of the vessels can be from a plaque. Oftentimes we think about that in the heart, but it can occur anywhere in the body, particularly in the vessels that supply blood to the brain. You can also have blood clots that form in the heart and travel. That's called cardioembolism. And then you also have small vessels. As you get further and further away from the heart, the vessels, the diameter of them becomes smaller in caliber, and they can be choked off gradually over time. And then you have a few more rare causes of stroke that can be related to infection or disruption of the vessel, like what we call a dissection.
Now, this study showed that people with both cavities and gum disease had almost twice the risk of stroke compared to people who had good oral health. Did that surprise you?
No, as Dr. Begum mentioned, some of this data has been known in the field that general oral health can be an indicator of overall health. So there's some associations between people who have difficulty taking care of their teeth, kind of follows with taking care of the rest of their body, right? And that can predispose you for a number of reasons to stroke and other cardiovascular disease. So in that sense, it wasn't surprising.
I want to add to the point, it may not be surprising to a healthcare person, especially to a dentist or a neurologist, but it is surprising to the patient, the public. Like, oh, I didn't know not taking care of my teeth can cause increased risk for stroke down the line.
Well, let me ask you about that. Gum disease, cavities. What is it about those that would increase my stroke risk? The inflammation?
It's hard to say because if you ask your dentist about a local infection within the mouth, for example, may not necessarily go elsewhere. However, let's say your gum disease is so bad or you're not taking care of your teeth daily as you're supposed to, you can have over time also called abscess formation. Again, everything is still local. But if you're compromised, if you have immunocompromised from other state like really bad diabetes, for example, you are maybe prone to developing a systemic infection from that. And sometimes you can have stroke. Again, there is no direct correlation. However, if there is overall increased inflammation, I don't think there are data shows that it's yes or no, but one would think that it could be inflammation elsewhere, like systemic inflammation can increase your risk for stroke, but I'm not sure if there's definitive data.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with two physicians who are training in neurology at Upstate, Dr. Moma Begum and Dr. Ron Miller. Now, what can you tell us about this study, which was done by researchers at the University of South Carolina? Do you know how many individuals participated?
They screened from over 11,000 people. This was from an older cohort known as the Atherosclerosis Risk and Community Study, and they narrowed it down to a sample of around 6,000, so 5,900 patients, which is impressive for the timeline that this study covers, over 20 years. This is probably the most powerful prospective study I've seen to analyze the relationship between periodontal disease and stroke.
So they looked over 20 years at this group of people and tracked how many of them had strokes, right? And tracked their dental care along the way?
Correct.
I think the limitation of the study, which they talked about, is that they had an assessment at the very beginning of the study 2 decades ago. And I don't believe that the study had yearly dental assessment. Correct me if I'm wrong. I think that's what they highlighted. That was the limitation for this specific study.
Did age or smoking history or body weight, did that have any influence, or how do they know that it was dental?
That's a very good question because I go back to the limitations. These patients were young. This patient did not have a lot of the comorbidities or risk factors, like, for example, blood pressure. What is the number one risk factor for someone developing stroke? It's hypertension, high blood pressure. And I believe that in this study, not every patient had high blood pressure. So it's hard to say that the results they found, it's due to periodontal disease and dental caries, rather than someone who did not have hypertension now develop hypertension or high blood sugar. So it's a good study in the sense, prospective study looking at over 2 decades and a lot of patients. However, I do not think that they looked at their dental assessment periodically, and also the patient population was not matched for someone who has like high blood pressure, smoking, other risk factor for stroke. So it's hard to say that it's truly a doubling effect of increased risk for stroke from just having periodontal disease.
So the study showed only an association, not
Exactly.
cause.
Yes.
Okay. Well, which was worse in terms of stroke risk? Did it break down between cavities versus gum disease? Because I know it was worse if you had both cavities and gum disease, but did it look at cavities in one category and gum disease in another?
They did. And the results were, it seems like if you were to have the gum disease and cavity, the risk almost doubles. Whereas if you just have the gum disease alone, then it's still high. Again, counting for all those limitations, still high, but it's definitely not as bad as having both.
I don't want to make too big of a leap here, but let me ask you, do you think improving oral health or maintaining good oral health could help reduce stroke risk? Dr. Miller?
Absolutely. I think this study certainly suggests strongly so that maintaining good oral health, particularly prevention, gingivitis, which, as I said before, is kind of the early stage of periodontal disease and the reversible stage, so that you don't develop periodontal disease plus cavities, would definitely be in the right direction towards preventing ischemic stroke, among other things.
And Dr. Begum, you agree?
Absolutely. I think just like any other good housekeeping when it comes to your health, anything that has any kind of association, it's good to be always on the preventive side rather than after the fact.
Well, Dr. Begum and Dr. Miller, I want to thank you so much for making time for this interview.
Thank you.
Thank you for having both of us here.
My guests have been Dr. Moma Begum and Dr. Ron Miller, both of whom are neurology residents at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.